Hi, I'm Jill Finkelstein, Regional Manager, HIM at Broward Health, Coral Springs. I'm here today with Dr. Paul Isaacs from FTI Consulting to get his perspective on why ICD-10 matters to physicians. Dr. Paul Isaacs?
Thank you, Jill. Again, my name is Dr. Isaacs. I'm a Senior Consultant of Health Solutions with FTI Consulting. And it's my honor to be able to give a little talk to my physician colleagues on the importance of ICD-10 and what it means to the profession. ICD-9 is very obsolete, it's outdated, and ICD-10 is a step in the right direction. Physicians strive to deliver quality health care to their patients, and ICD-10 brings this quality up to date with the new medical terminology, the clinical acknowledgement, accounts for the new procedures, and the new devices that are being current today. It's been over 20 years since it's been recommended that ICD-9 was coming to a stress point. And the National Committee on Health Statistics has actually advised HHS probably 10 years ago that it's about now time that ICD-10 is implemented. There's a lot of benefits to ICD-10 for physicians. One, it creates reimbursement opportunities. It drives reimbursement by creating quality data. It helps physician practices that are doing research to be able to communicate and get the best research possible for their data, for their research projects. It also reduces the amount of claim rejections by the quality and the specificity of the code, the documentation that's required for the code assignment. So yes, there's a lot of benefits for ICD-10. There is, from my perspective and from a lot of my physician colleagues, there's a lot of conversation on the cumbersomeness of ICD-10, why it's required, the amount of the codes, why such from escalation from 4,000 to current 68,000 codes. But if we look at it, really, 46% of the codes is really due to site specificity or laterality, as we call it. So it's a matter of, in ICD-9, did not have the capability of giving that degree of specificity when it comes to procedures or diagnoses.
Excellent, thank you for sharing that. And one last question. Dr. Isaacs, could you share some helpful tips or resources that you found particularly helpful in transitioning your small physician office practice to ICD-10?
Certainly. There's a lot of free resources out on the internet. Specifically, CMS publishes Road to 10 for physicians' practices, specifically geared towards small practices which are more likely to have difficulties. And I've actually shared this resource to my physician group. It really has a lot of pertinent checklists, implementation plan to guide small practices through this implementation process.
Excellent. Thank you so much for taking the time out and sharing some great information with our association. Thank you.
You're welcome. Thank you.